Hello?
Okay, this is Jeff with the YouTube channel DSH Abuse and the website dshabuse.org. I have on the phone with me a gentleman. His name is Daniel Hernandez, also known as Cuba. Are you in line, sir?
Yes.
Okay. And do you consent to being recorded?
Yes.
Okay. You're a patient at Coalinga State Hospital, and today's date is July 18th, 2020. You're currently housed on what's known as a Unit 5, correct?
Yes. And
you came from Unit 17?
Yes.
And on the date you came was July 13th. Was that correct?
I believe so, yes.
And that's because you were diagnosed or found to be positive for COVID-19?
Yes.
Okay. And how are you feeling today?
Feeling pretty lousy, just really lethargic, having trouble breathing, have massive headaches and really bad body pain all over, and diarrhea. And congested. I'm very congested in my nose. And the headaches are damn near unbearable. I have ibuprofen to take and Tylenol, but it's not really working. And I'm not being given anything that should be specifically given to me to counteract the coronavirus, if that makes any sense.
Okay. So, well, that's we're going to address that at the very end of the interview.
Okay.
We're going to be posting this on YouTube, as I shared with you, immediately following this interview. So we're going to ask you about what treatment you're receiving at the end. But what I want to start with is, and how many people? 7 more patients were taken. So when you were taken on the 13th, how many patients went with you to the quarantine unit? By the way, Unit 5 is a quarantine unit, correct?
I went by myself.
Okay. Didn't 2 other patients go with you, or what?
No, they followed me by about a couple of days. I think it was 3 days they followed.
Okay, so 3 days they followed you, and then today, how many came today?
8.
8 more today?
Perhaps 9. They've been in the room, so I haven't gotten a chance to go down the hallways and see who's in which room, but as best I can tell...
We heard there were 7, and there's a total of 10 now, so...
There's a total of 10, yes.
Okay, so 3, you, plus 2, plus 7, that would make 10. Okay.
Yeah.
So prior to you going down there from Unit 17 and being tested positive, what did you observe on Unit 17 in terms of staff wearing masks and not wearing masks? And I'm talking about in the days preceding you being tested positive.
Some were wearing their masks partially, some weren't wearing them at all, but in the office, and some weren't wearing any outside of the office.
And by outside of the office, would that mean like playing cards with patients in the day room and being in common areas?
Yes.
Okay. And by in the office, do you mean like in proximity to other staff, like sitting next to each other near the computer and that sort of thing?
Yes.
Okay.
And several mentioning that they had no preoccupation with getting sick, as I recall that distinctly.
What did you say?
They said that they're not worried about getting sick.
That they weren't worried about getting sick.
Yeah.
Now, what about in the med room? As far as staff wearing their masks in the medication room, passing out medication to patients?
Occasionally there was. Occasionally there weren't. Again, 1 or 2 said that they're not afraid of getting sick.
They weren't afraid of getting sick.
Yeah, but they were passing medication through the window, and oftentimes not wearing gloves.
Not wearing gloves.
Yeah.
Okay. Now, and we now have 10 patients. All these patients they came to you. They're on the quarantine unit that have COVID-19. These are all from Unit 17, correct?
Yes. Okay.
Now, in terms of cleaning the unit, you were on the unit for how long?
Since Monday.
Excuse me. I mean, how long were you on Unit 17? How many months?
Oh, I was several years.
Several years. So let's talk about, just for example, a month prior to you getting sick.
Yes.
Did you ever see the staff coming out during the day and wiping down the microwave and the refrigerator and the tables?
Perhaps wiping the chairs a few times, but not really to the degree that they do here. However, they haven't done it today.
Let's talk about Unit 17 right now.
Okay.
Did you ever see the staff come out several times a day, or at all, wipe down the refrigerator and the microwave and
no. No.
Not at all?
No, I was actually doing it.
Okay, but in terms of like every 2 hours or anything like that, you never saw the staff do that?
No.
Okay.
It's not that I never saw them do it, but I've seen it done a few times.
But not on a regular basis every day?
No.
What about wiping down the stalls in the doors in the bathroom, the soap dispensers? Did you ever see the staff doing that on a regular basis?
No, I was the one cleaning the bathroom.
I'm talking about the level of care staff, the psych techs.
Okay. I'm trying to tell you that I was the one cleaning the bathroom. That was my assignment, and I Tyvek'd it and disinfected it daily.
No, okay, I understand that the patients have that assignment, but we're talking about the staff. Do you ever see the staff every 2 hours going around wiping the doorknobs and the door frames and stuff like that?
The doorknobs occasionally, but they actually had a patient that was assigned to do that, so they basically counted on the person doing it, and they themselves didn't do it.
So they depended on the patients to do it.
In my opinion, they were assigned to it, so it was like almost a given that they were being cleaned.
Okay. Again, I don't feel I'm getting a clear answer from you. Did you ever see the staff doing this on a regular basis several times a day?
No, because the patients were doing it. These things that you're asking about, the patients were doing it, therefore they did not do it.
So the patients were doing it, not the staff, and we now have 10 corona cases from Unit 17. Clearly, okay. Now let's discuss. Discuss what's happening down on Unit 5, where you're at the quarantine unit. No, before you when you left Unit 17 and they told you you were going to the quarantine unit, it was pretty distressful for you, correct? They told you that you couldn't take even your address book with your address in it for your family and things like that, right?
They said I couldn't take anything.
Right. And that would include your address book with your family's addresses and phone numbers and maybe your banking information, critical information that you would need perhaps on Unit 5 to just function in your life, right?
Yeah, and let's take it a little bit further. My legal papers were denied me as well. Court documents.
Your legal papers,
yes.
Any financial papers,
yes.
Your address to your attorney, things like
yes.
that. They told you couldn't take any of that stuff.
Any and all information, I felt that they were going to hold me incommunicado, and I expressed that I should be able to take these things with me, and in all reality, I actually concealed it and brought it with me.
Right.
I brought the phone book and some stamps.
You had to sneak a book of stamps and your wallet in your pocket.
Yeah.
Right. And so down on Unit 5, the quarantine unit, you mentioned that you've been given no information, that you feel kind of abandoned. You haven't seen a psychologist?
No.
You haven't seen a social worker?
No.
And you did see a telepsychiatrist briefly?
For about 10 minutes.
For about 10 minutes.
Yes.
Now, you mentioned that there's a couple low-functioning patients that
yes.
you refer to as MDO, and by MDO you just mean by low-functioning, correct?
Yes.
And that they, on the conference call, you participated in an emergency conference call yesterday that we posted on DSH abuse, correct?
Yes.
And basically you said on that call that they have no idea what's happening to them, and they're pretty much out of it.
They're pretty much out of it, and they stay in their rooms, and they're like out of the way, therefore they're not thought of much. But I told the staff the past 2 days to include them and give them everything I get.
But except for the fact that you're advocating for them, it's your perception that the staff are otherwise ignoring their existence?
Well, in my opinion, yes, they're giving them the basics, and they haven't had the benefit of a social worker or a psychologist, or they haven't had the benefit, the things that I've received. The one contact that I had with the telepsych, they've received nothing in that regard. They've received the basics, just food.
How do you know that they haven't seen the telepsychiatrist as well?
I've been here paying attention.
Okay, so you don't know if they've seen a telepsychiatrist?
No, I can tell you almost categorically that they have not seen anyone, because there's no evidence that they've seen anyone. They've been in their rooms, and for such reasons as maybe going to canteen or such, I try to include them. They say, oh, no, we don't want to wake them up.
Okay. Now, let's talk about cleaning. Real quickly, you mentioned, now when you went to, this is very interesting, when you went to the quarantine unit where the COVID patients are, you said that they were cleaning the unit very regularly, correct?
Here at Unit 5, regularly in some respects, but kind of like halfway doing it. They didn't do it yesterday, and they didn't do it today.
So they didn't clean the unit?
But in the days prior, they were kind of like cleaning a little bit here, a little bit there, but they weren't cleaning the way I expected them to clean, the way I had seen it done once or twice since I've been here.
So what do you mean they weren't clean? Okay, so they didn't clean the unit at all yesterday?
Not at all, and they haven't so far today.
What do you mean? They're not cleaning the toilets? They didn't clean the sinks or anything like that?
Nope. They had a janitor come and clean the bathroom 2 days in a row, but prior to that, they weren't coming. And when they leave, the bathroom's still dirty. The sinks are still dirty, and there's stains all over the damn place.
And so yesterday, did the janitor come and clean? Did the janitor clean yesterday?
I believe so. The bathroom only.
Only. So,
and he
so when
the
you
trash.
say they didn't clean, so what do you mean when you say they didn't clean it all yesterday? They didn't wipe down the tables in the day room. They didn't wipe down the microwave or any of those surfaces.
Nope. I've been doing it.
You've been doing it.
Because they're not doing it, I'm doing it.
What kind of chemicals are they giving you to clean with?
They said I can have the handi wipes, and they said basically the handi wipes, the green container, I guess they say that you can't use even with gloves because patients are supposed to have them, but they're a higher quality.
Hold on. Let's just say let's describe what you mean by the green. The green is the Clorox wipes, okay, and they're saying that you're not allowed to use those,
right,
even with gloves.
Yeah.
Because they're saying that patients are not allowed to use those. So which wipes are they allowing you to use?
The Sani wipes.
The Sani wipes. And by Sani wipes, I think you're referring to the ones with the blue top?
Right.
And those are the alcohol wipes.
And they've told me several times that don't worry about cleaning because they're going to clean. They're cleaning. And I said, well, I'd like to clean my room. They put me in a dirty, filthy room that has stains all over it, all over the sink.
Okay, hold on. You're breaking up. They put you in a dirty, filthy. You're breaking up? Are you close to the base station?
No, I'm close to the back door and the entrance to the courtyard.
Okay, hold on. You're breaking up. Please stay close to the base. So they put you in a dirty, filthy room with stains all over it?
Yeah, well, the sink and all that, it was dirty. They put the cosmetics, the state cosmetics on top of a paper towel, but it was dirty. The area was dirty. The floor's still dirty. And it was clearly, had somebody else been in there with the coronavirus, I would have contracted it that way too. Is that dirty?
So the room appeared to have not been cleaned prior to putting you in there?
Yeah. And think about the other guys in the other rooms, specifically the two MDOs, they were just put in rooms that were equally dirty. Not filthy, but dirty.
And you looked in those rooms yourself and saw that they were dirty?
Yes, because I went over there and checked on them 2 or 3 times a day.
Wow. Unbelievable. Unbelievable.
Yeah, it's unbelievable. It's frustrating. And I have, I'm trying to keep my health, but I'm answering all the questions. I'm getting 20, 30 phone calls a day, and I'm doing the best I can. But, even as I sit here, I'm having trouble breathing, and I just feel like I've got no energy. I'm having difficulty walking. I got a headache that you wouldn't believe, but I'm taking Tylenol and gabapentin. I believe I mentioned that already. But it's really a spooky feeling. And the guys that just came over here, they're quiet. They're laying in their bed. They're scared to death, and I'm trying my best to help them and tell them, look, I went through this already. Let me help you. Let me advise you. Let me help you call your mom or your sister or your wife. Another phone's ringing. Okay.
Let me, you want to go ahead and answer that phone?
Yeah, I'm on my way. It's got to be for me. Okay, give me a second. Hello? Yes, give me a minute, okay? I got to put you down for a minute because I'm on another line doing an interview. All right. Okay, somebody else called. Let's do the interview.
Yeah, we're almost done here. It sounds like you're the one taking care of the patients. And let me ask you this: how many staff are working on that unit?
5. Counting the nurse, 5.
How many?
5.
Are they in full PPE? How are they gowned up?
Say that again.
What are they wearing? Are they in full gowns, full protective gear?
Yeah. They're wearing goggles. They're wearing face masks. Well, the nurse is, and they're wearing the white jumpsuit, those white suits, and the nurse is wearing a shield. They're coming in. They're monitoring our blood pressure, things of that sort. There's 4 or 5, and you know what? They're working. The same ones are working a lot of overtime.
Okay.
A lot of overtime.
Are they coming out and interacting with all the patients and caring for all of you guys?
No, actually, they're not. You have to stop them and engage them, but basically they're not, and they weren't with me anyway when I first got here. I had to pursue them and explain to them that any preoccupation they might have with my previous behavior should not allow anyone to discriminate against me, and slowly but surely they began treating me in a respectful manner.
Do they have staff out on the floor at all times?
No.
So if a patient needs help, they can hear a patient calling for help?
No, they're just checking every 15 minutes.
Okay, so if a patient calls out for help, none of the staff will hear them calling for help?
No, they're in the office, and they have large fans, power like 100 voltage Someri fans, little square fans that generate a lot of air, and they make a lot of noise, so it'd be hard for them to hear because I have difficulty hearing the phone, and I'm in the day room. They have fans in the hallway.
In the hallway? Oh, in the hallway?
Yeah, they have, and they also have them in the day room. Have one in the day room.
Oh, you know, I think why they did that, I think they turned off the central air system so that air is not blowing to other units.
My understanding is, I believe I overheard them say that it was back on. They turned it back on to make it warmer in here because it's like an ice box.
Wow. So none of the rooms have a call button to call for help, correct?
No call button.
And they're only checking the patients. Is there a doctor coming around every day to check on the patients?
I haven't seen a doctor today. No, I haven't seen a doctor today. Just a nurse.
When's the last time you saw a doctor?
Have you seen a doctor today? No. I just asked one patient if he's seen anybody, and he said he saw the nurse.
When's the last time you've seen a doctor?
Me, it's been 2 or 3 days now. I think 3 days. That was
3 days
after
since you've seen a doctor.
Yeah, and yes. And he told me that I'd be getting the results in a couple of days, and that was 3 days ago.
So you're having trouble breathing, and you're having all these medical conditions, and the doctor, they don't have a doctor monitoring you guys on a daily basis?
No.
Okay.
He comes in after the blood test. He comes in on occasion if there's an assessment, and again, both the doctors are kind of nonchalant.
Okay.
They're very non-committal. You almost feel like that you're there for them to ask you a few questions, and then that's it. They also do your vitals, so that's something they do, and they ask you how you're feeling, and then you tell them, and then actually one tech actually said, well, I haven't seen you cough, and I'm like, well, what? I have to justify to you and that I'm coughing, legitimize the fact that I'm coughing? And he says, oh, no. Well, that's basically what you're saying. Are you saying that I'm not sick and you're minimizing my needs? And they said, oh, no, we're not. And, it was kind of like I'm arguing for my health and saying, believe me, please believe me, because this is serious.
So you're telling them that you're having coronavirus symptoms because you're trying to get relief for those symptoms, and she's suggesting that you're not having those symptoms because she hasn't observed them?
Yeah, specifically the coughing. So now I'm actually taking the phlegm on a napkin and showing it to them when I cough it up. And they told me, well, it's not that big a deal because it's not dark. It was dark a week ago. Now it's kind of beige, but it's a lot of it.
So you're currently coughing up phlegm?
Yeah, a bunch of it.
You're currently coughing up phlegm, and you have not seen a doctor in 3 days?
Yes.
You got to be kidding me.
No. Because they said, and I showed it to the nurse, they said, well, it's not dark, so it's not that serious, and you just coughing it up, and that's to clear your throat, and you'll feel better. And don't feel bad about diarrhea, because the diarrhea is actually helping you process what you need to be rid of, your body needs to be rid of.
You got to be kidding me.
I haven't had a hard stool in, like almost a week.
Oh, my God. Listen, we're going to make sure we get this to your attorney immediately, and we're going to put this on YouTube. I'm glad. Thank God you're doing this interview, not only for yourself but for the other people. Before we had this interview, you told me that I think you touched on it briefly, but when you talked to the doctor, it was more about him asking you questions. He never went into great depth to explain the coronavirus to you, correct?
No. No, they just told me They told me my symptoms were part of the sickness, and that I would get over it. They never mentioned anything about medications that they might try for treatment, and that's it. And they didn't actually tell me what the results were of the tests, and I assumed they were going to tell me. I wondered why they didn't tell me. I knew I had a right to be told, but nothing was ever mentioned except for the fact that I'll take one again, and then I'll take one again, and then 14 days after I take one, they'll determine whether or not I'm released. So it would be on the second day after the 14 days that I would be released back to the unit.
Okay. One last thing regarding the masks, the wearing of masks. When you're on Unit 17, and I already know the answer to this question, but did you ever see a public health nurse come to your unit and call everybody into the day room and explain to everybody the importance of wearing masks and why patients should wear masks and all that?
No, the U.S. did it to some degree, and that was the extent of it.
But never a nurse, a public health nurse that works at the hospital?
No.
Just a unit supervisor?
Yes.
Okay. And when coronavirus was breaking out and all that, nobody ever took it seriously, did they?
To my extent, not the way they should have. I think they took it lightly. I think they were equally afraid. I know when they told me and I was leaving the unit, they were just all huddled in the office, kind of like saying, oh, shit.
Yeah. Okay. Well, listen, I know you have a lot of calls. Take care of yourself. We're going to make this interview available to everybody. It'll be on YouTube in within an hour or so. I wish you well, buddy. We'll be in touch, okay?
Thank you. I'm truthfully just trying to stay out of the hospital. I don't want to die.
Well, like I say, we're going to do everything we can to help you. Thank you for your interview.
Thank you.
Okay, bye-bye.
Bye-bye.